Hi, I'm Shayna Beagle. This is our final assessment head to toe for physical assessment course. I would start off by washing my hands as usual. Going to introduce myself to the patient. Hello.
Hi.
I'm Shayna. I'll be your nurse tonight. Can I ask you your name and birthday?
Matt Beagle, 9/11/83.
Very good. Is there anything that's been bothering you this evening here, Matt?
No.
Okay. I would also note that your appearance seems appropriate for your age. 83 puts you around 30 years old. He's obviously awake, alert, oriented ×3. Just generally looking at you, your skin is nice and tan. It looks intact. You appear to have a good nutritional status. Your posture, slouching a little bit, but generally looks good. Your muscle tone and everything appears good. Facial expression looks symmetrical and normal. You seem to be in a good mood. I see you just sat up a little bit there. Appears to have good hygiene, and he seems to understand everything that I'm saying. So we're just going to start off with your assessment, okay? I'm going to walk you over here first. I'd like to get your height and weight. Go ahead and step up on the scale. And 165, very good. I'm going to have you step over here, and we're going to measure you. And I'm getting about 5'8". Okay, come back over. That all looks very good. I'm just going to write that down. Okay, very good. Next, I'm going to have you check your eyes. Okay, I see that you do wear glasses. You wear those all the time?
Yes.
I'm going to have you cover one eye here first, and have you read the bottom line of the Snellen eye chart.
PECFD.
Very good. And same thing on the other side.
PECFD.
Great. Okay. Any trouble seeing that at all?
No.
Okay, so that would give you 20/20 vision with your glasses. Next, I'm going to check your vital signs, okay? I'm going to get you to go ahead. Put this under your tongue here. Clean that off. Go ahead and put that under your tongue for me, sir. And while you're doing that, I'm going to grab your pulse. Okay. Take a look at that. Good. 98.5. That's great. That's normal. And I'm getting about 80 beats per minute, and your respirations are 20, which is perfectly normal as well. Going to get your blood pressure next. On each side, let me just write those vitals down. Very good. So I can see it here. (126/80). That's great. And check the other side. And that side I'm getting 142/80. A little bit higher, but still very good. And lastly, I'd just like to ask you, are you having any pain this evening?
No.
Very good. Okay. 142. Okay, very good. Next here, just want to take a look at your hands and nails. Good capillary refill and good skin charger, and all your skin appears intact. I don't notice any lesions or nevi. That looks great. Go ahead and relax there. Check your head next. Your scalp is normal cephalic. There's no lesions or anything. Your hair is intact. Everything looks good there. Take a look at you. Smile for me. Good. And frown. Good. You got good facial symmetry. Everything looks good there. Check your temporal arteries. Good. And go ahead and open your mouth for me. Check your temporomandibular joint. Go ahead and close. And one more time. Good. Next, I'm just going to check your sinuses. I'm going to touch your face, okay? Maxillary sinuses look good. And your frontal, any pain with any of those?
No.
Good. Okay. Next, we're going to do another test with your eyes, okay? This one, I want you to tell me when you see my hand come into your view, okay?
Yep. Yeah. Yep. Yeah. Yep. Mm-hmm.
Good. Okay. And next, I'm going to check your corneal light reflex. Just going to shine a light into your eyes. Just look straight ahead. Good. And equal response in both sides. That looks great. Going to put those back on you. Next one, cardinal positions of gaze. I'm going to have you follow my pen, okay? Good. And you had parallel tracking with all of that. Just going to look at your eyebrows here. They're symmetrical. I don't notice any lesions. Your eyelids, can you close your eyes for me? When you close your eyes, they're even. Go ahead and open. Your eyelashes and everything look good. Once again, I'm just going to move your glasses for a second. Go ahead, I'm going to pull down your eyes here. Got clear conjunctiva. Very good. And the sclera are nice and white. I'm going to just take these off for now, okay? Sit those over here. I'm going to take a look here at your cornea. I'm going to shine a little bit of light just because it's a little dark in here. Corneas and irises and everything look good. Check your pupillary light reflex. Your pupils accommodate to the light. They appear about a 3 millimeters in size, and they're equal round and reactive, so everything looks good there. Next, what I'm going to have you do, I'm going to have you look at my pen, and then look at the wall, and then look back at the pen, okay? Look at my pen, look at the wall. Just with your eyes, I'm sorry, just with your eyes. And back at my pen. How about, I'll have you look over this way towards the television. There you go. Good, good. And they do accommodate, so that's great. Next, I'm gonna do, check your red reflex. Just have you look straight ahead for me, okay? Good. And you have a good positive red reflex on that side. We'll check it on that side. And that's good as well. Very good. Next, I'm going to get real close here. I'm going to check your eyes out. I'm going to check your optic disc and your retinal vessels. Okay, I'm just going to peek inside your eye. I'm checking also your general background, your macula. Everything looks good on the left. And everything appears normal on the right. I will write that all out in detail for you on the final report, okay? It's a lot of stuff to go over. Next here, check your ears. Oh, pen light's acting up here. All right, so just going to check for them. They're symmetrical. Any pain when I do any of that?
No.
Good. No tenderness or anything? Oh, I'm sorry, sir. I'm going to give you back your glasses. I'm going to check now into your ear, okay? And put my scope in your ear. Okay. Here we go. So I'm noticing your eardrum is a nice pearl gray color. Then we're also noting the position, the landmark integrity. Check the same on the other side here. And that side looks good as well. Okay. Also gonna have you hold and go like this on one side, and I'm gonna whisper something into the other, and I want you to tell me what I'm saying, okay?
A, B.
Good. Same thing on the other side.
Elephant.
Great. Good, good, good. So you're hearing everything looks good there. Let me get my next equipment here. All right. So first, I'm just gonna place this tuning fork on your head. You tell me when you feel it vibrate, okay?
Yep.
Okay. And same thing.
Yeah. Yep.
Okay. Great. All right. And next, I'm gonna take a peek at your nose, okay? Get all my equipment ready here. So first off, your nose is symmetrical. I don't notice any lesions. Everything looks good there. Check your patency. Take a sniff. And this side. Good. Everything looks good there. I'm going to take a peek up your nose, actually. Good. I'm noting your nasal mucosa. Septum appears intact. Also noting your turbinates. And everything looks good on that side as well. Any problems with breathing through your nose?
No.
Good. Okay. Next, we're going to check your mouth. Just get my pen light for this one. And put my gloves on as well. Going to take a look here. Open your mouth for me, please. I'm noting your hard and soft palate, your tongue, your teeth. Go ahead and smile for me. Good. All your teeth appear intact. Go ahead and open again for me. It's moist inside there. Take a peek at your buccal mucosa. Good. And go ahead and stick your tongue out for me. Good. Everything looks good there. And lastly, I'm going to have you first say ah. Go Good. And everything looks good. And then I'm going to also check your gag reflex, okay? I know, I'm sorry. Okay. And that looks good. Let me take off my gloves here. Wash my hands again. Okay. Slowly getting there. Still a lot to go over, but this is all important stuff, okay? Next, I'm just going to check your neck. It's midline, it's symmetrical. You have good muscle tone. You don't notice any lumps or abnormal pulsations. And also gonna then check your lymph nodes, your preauricular, posterior auricular, occipital, submental, your jugulogastric, got ahead of myself. Superficial cervical, turn your head to the side for me. Another side, deep cervical chain. Posterior cervical, and shrug your shoulders. Supraclavicular. And they all appear good, no tenderness or pain with any of those?
No.
Good. And myself here. Just going to check your carotid pulse. Good. And on this side. Good. I'm going to take a listen, make sure there's no bruise. That sounds good on that side. That sounds good on that side as well. Okay. Check your trachea. That looks good. midline as well. Everything looks good with that. Now we're going to do range of motion, okay? I'm going to have you head up and down. Good. Left to right and side to side. Any pain with any of that?
No.
Good. Once again, side to side with resistance. Good. Just checking your muscle strength. Good. Okay. Next, I'm going to have you here have a sip of water. Have you scooch out a little bit here so I can get behind you. I'm going to check your thyroid gland, okay? Good. Any pain or tenderness with that?
No.
That's great. Okay. Go ahead and sit back. Very, very good. Okay. So we're going to switch gears here, and we're going to check your thorax and abdomen next, okay? So actually, I'm going to have you come back out, and I'm going to have you take your shirt off for me, okay? Good. Okay. So taking a look here at things. Everything looks nice and symmetrical. I don't notice any lesions. Take a look here at the front as well. That's great. I'm going to have you take a deep breath here for me. And it's good equal chest expansion. Very good. Same thing on the front. Good. And once again, good equal chest expansion. The next thing I'm going to do is I'm going to have you see 99 while I palpate you, okay? Let's go ahead.
99, 99, 99, 99.
Good. Same thing on the front.
99, 99, 99, 99.
Good. And I don't notice any tactile fremitus, so that looks great. I'm going to palpate you here. Any tenderness?
No.
I don't notice any lumps or tenderness either. That's great. And I'm going to check your spinous process here. Lean a little bit forward for me. Any tenderness or pain with that?
No.
Good. Go ahead and come back up and relax. Next, what I'm going to do is I'm going to give you a little tap on each kidney, okay? Tell me if you have any pain or tenderness. Any pain or tenderness?
No.
Very good. Okay. So now I'm going to take a listen to you, okay? I'm going to listen to you in the back first. Then we'll listen to the front. Deep breath. Good. Same thing in the front. Deep breath. Okay, everything sounds good there. Okay. Let me grab my pen here and my ruler. First, I'm just gonna kind of percuss down you, okay? Same thing across the front here. Good. So now I'm going to do the same thing again. I'm going to have you take a deep breath in for me. And now I want you to give me a big exhale, okay? And same thing again. Deep breath in. Good. And exhale. Okay. And measuring your diaphragmatic excursion. That's great. Write that down. And that's within normal range. Okay. And then when I listened to you, I didn't auscultate any abnormal breath sounds, so everything sounded good there. Okay. Your skin all appeared intact. I didn't notice any lesions. It's nice and warm and dry. There's no swelling or edema, and no diaphoresis. So that's good. While I'm sitting here, I'm going to have you lean forward. I'm going to take a listen to your heart. Take a deep breath in. Good. I don't hear any murmurs or anything, so that sounds good as well. All right. Give me 1 second here, sir. It's a little hot in here. All right, I think next we move on to arms. I think we covered all the bases with all of that. As I noted earlier, everything looks good. Your skin with your arms. I want you to do some range of motion with me. I want you to bend your hands up and down, and your arms in and down. Arms out to your side, behind your head. Good. Any pain or tenderness with any of that?
No.
I'm going to palpate your epitrochlear nodes. That's great. They seem good. No pain with that, right?
No.
Okay. Next, I'm going to check your chest here. Just going to inspect your breasts. They appear normal, symmetrical. That's good. I don't notice any lesions. I'm going to have you go ahead and lift your arm for me here. Check your axillary lymph nodes. I don't notice any swelling or tenderness there. Same thing on the other side. Good. And I'm also going to check your regional lymph nodes. And they seem good as well. And your breasts feel good. I don't notice any lumps. Even guys should, check themselves, do breast exams at home, once a month. Just feel for any lumps or bumps and let your doctor know if there's anything abnormal, okay?
Okay.
I know that's kind of silly, but that's important to do. All right, I'm going to have you go ahead and lay down for me next. Go ahead and put your head down there. I'm going to put you about 30 degrees. I'm just going to take a look at your neck vessels. Don't notice any abnormal pulsations. Just, your everything appears good there. Looking at your jugular veins. Okay. Just gonna once again feel your pulse. Good. And I'm going to check your precordium. Everything looks good. There's no abnormal pulsations. Palpate your apical pulse. And that looks good, and it's in the proper position. Checking your precordium. I don't notice any abnormal thrills or anything. And I listen to your apical pulse. It's a normal rhythm. I'm just calculating the rate. Getting about 80 beats per minute, which is great. That's normal. Very good. And just going to listen here again with a different part of my stethoscope. Same thing again. I don't notice any adventitious heart sounds. No murmurs. I'm going to have you lay on your left side for me. listening once again for any murmurs. Sometimes position can make them a little more prominent if they're there. And I'm going to listen again. Okay, everything sounds great. Okay, go ahead and roll back over to your back here, sir. And I'm actually going to take your pillow. I apologize. Got to get you to lay completely flat here. We're going to take a peek at your belly, okay? So you have a normal contour, good symmetry. I don't notice any abnormal pulsations. Your umbilicus is midline. That looks good. Next, I'm going to take a listen to your vowel sounds, okay? Good. Vowel sounds are present in all 4 quadrants. I'm also going to listen for your vascular sounds. Your aorta, renal arteries, your iliac arteries, and your femoral pulse. Good. Next, I'm going to percuss your abdomen. I know this is all silly stuff, sir. I apologize. All right, I'm going to percuss next. I'm going to get my pen here. Percuss where your liver is. Okay. And also your spleen, really. And I would measure those, and they're normal. I still had a minute left.